at home. I'm on my clinic. I'm working.
Yeah. Are you working? I took
Yes.
today off. Yeah. I could have been
You see,
working because I
I was doing my lasers. I was doing my consultation, my surgery. This journey is so full.
I know, I agree. I had yeah, I had to go in to see a laser patient this morning. We did 5 last week, and I think one of them may have a small herpes outbreak. I just wanted to make sure because I was supposed to be going to our Cork clinic, and it's just I'll be
Uh,
away for a few days.
he told us, Mr. Patrick, you close your microphone. So he told us that to start the direct. You close your phone. You close your microphone. Oh,
Oh
okay.
no, it's back on. Sorry, I don't know why that happened. Okay.
Perfect, perfect.
Let's start. Let's start. Here we go.
Yes, 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 yes. You can start.
So are we
We can start.
watching it now? Are
You
we
can start.
watching it now on LinkedIn? Is it?
Yes,
Yes.
yes, 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 yes. And
Okay.
We are on the direct, Mr.
YouTube.
Patrick.
Yes.
So you, you start. You are we are in the YouTube. You are we start.
So I'm watching this now on LinkedIn. Yeah. Okay. Rashid, did I just say something or anything or?
You start. You open the station.
Okay, and that means I have to go in to see what lectures are coming up. Yeah.
Yes, we have one, two, three, four. Me, five, and you, Mr. Tracy. One, two, three, four, five, six,
Okay.
seven.
So I see that. So do you want me now to say something? Is it?
Yes, to introduce the station.
Okay. I and tell me when to go and I'll go.
We start. We are on a direct.
I see. Okay. Well, listen. Welcome to the cosmetic dermatology session of the World Dermatology Day. And so we have lots of interesting lectures here today. We have first laser assisted transepidermal drug delivery in dermatology. And we've been using this for quite a period of time. Particularly, we tend to use it originally for stem cells, but now for exosomes quite a lot. And Professor El Motion is going to give us that particular session to the or lecture to the session. And then we a lot of it is based on regeneration now because we're also going to have some injectable skin boosters, and we know that there's 2 or 3 things there. The first thing is exosomes per se. As yet, we can't inject them directly, but we can certainly use them through microneedling, microneedling radiofrequency, or laser assisted. The interesting thing is, I was in a webinar earlier to Dubai, and they're considering, and they are looking to the DHA to do exosomes intravenously now, the same as we've been doing, I suppose, with stem cells for a period of time. So that's interesting. So the next lecture then is by Dr. Roy, and it's going to be reviewing laser treatment outcomes for trichoepitheliomas. I'm going to have case studies of that. And then this is one that I'm going to
Sorry,
love.
sorry,
Yes.
Mr. Patrick. Sorry. For this case, I participate with one case, wonderful cases of Miriam Ruai.
Oh, fantastic. So in Ireland now, we get a lot of African immigrants, particularly from Nigeria, and we get so many kilos of the ear that I would be so sort of interested in this. We've been attempting recently, I suppose, particularly using cryotherapy up the center, while at the same time, obviously using steroids and different strategies. So I would get a lot of those patients. I'd almost get one a week at the moment. And I suppose it's so disappointing in some days when you have it all treated, you've seen them for 2 or 3 months, it's all gone. And then just when you think everything is good, like a year later, they come back, and often because they know that it's going to cost them some money, they let it become really big again before you go back into it.
Yes,
And
yes, really, yes. It's very big, big problem. We
oh,
at the end, sometimes we don't
and
have a good solution. Yes, of course.
yeah, I know. And I was in Uganda recently, and the number of people that I've seen with keloids was quite startling. And I had some depomedrone with me. Believe it or not, we had a small clinic near Fort Portrell, and I started treating some of these patients. But when the word goes round, so then we referred them into the hospital, who had almost given up on a lot of them, you know. And Doctor, I suppose you yourself, Rashid, you're going to be talking about
Yes,
the laser technologies.
yes,
So I'm really looking
yes.
forward to that as well, for sure. And then there's myself with aesthetic complications. So we've been dealing with aesthetic complications since, I suppose, this began. And that's certainly back to the last century, 1998, 1999. And what I'm doing is I'm integrating in this lecture the integration of us also with pandemics. We first had the HIV pandemic, and then when we treated patients with that, we had obviously bioactimate was used for HIV lipodystrophy. It caused its own problems. Originally, Sculptor caused problems. And I'm also looking now, after the COVID vaccine, how we got delayed tissue nodules
Yes.
and how we to treat that with obviously methotrexate. And we were the first, I suppose, clinic to do that. But all the other complications as well. Within that lecture, it's a little older now. I look at Botox, lasers, and all the dermal filler complications. And of course, we have books on that as well. So, Rashid, are we ready to go then? Or
Yeah, I'm ready. I'm ready to see you also in my screen. I don't hear you now.
okay,
I'm ready.
yes.
Let's start our session together. And I was so glad and so happy to see you again.
Oh, thank you.
And it's a very good opportunity. Thank you, Ibrahima, to let us to discuss about
Please
all the
start.
what we do every day.
Please stay here after session.
Yes, we are here. We are together.
Stay here, please.
Okay, wonderful.
Okay. Perfect. Okay. Facebook, LinkedIn, and YouTube.
I'm on a WhatsApp
Yes,
group.
I'm seeing YouTube also.
Yes. All. Facebook, LinkedIn, YouTube. Now.
Okay, and what I'm going to do as well is I've 8,000 doctors, aesthetic doctors, on the LinkedIn group. Rashid, I don't know whether you're on it, but I'll put this on it. And I have another WhatsApp group with 140 doctors. So I'll do both. Yeah.
Okay. Yes. Okay. Perfect. Okay. Please.
Let me just take a call that's coming in. Thanks.
Alors, c'est vrai, Rachid ne va pas. Rachid, restez là comme ça.
Oui.
Restez là comme
Moi,
ça.
je suis là.
Viens me projeter l'autre là maintenant sur les chaînes là. Hein?
Je suis là. Je n'étais pas connecté sur mon PC et là, je suis là. Voilà.
Reste là. Et moi, je vais lancer l'autre là. Après, je reviens. Hein?
Je suis là.
D'accord.
Je suis en direct. Je garde ma caméra ou bien non, Ibrahima?
Bon, vous pouvez ne pas garder d'abord. Laisse la caméra. Fermez la caméra en attendant.
Je ferme la caméra. Ça me fait à les États-Unis.
Voilà, fais-moi aussi le micro aussi, s'il vous plaît. Rachid, fais-moi aussi le micro.
Je laisse mon micro, Ibrahima.
Fermez aussi.
Ferme le micro. OK.